Do you know that more than 5 million deaths globally each year, and routine infection in future could mean death? This is because the inappropriate use and overuse of antibiotics are driving a global increase in antimicrobial resistance and impacting the effectiveness of these critical medicines. As you know, antimicrobial resistance is the ability of bacteria, fungi, viruses, and parasites to resist the effects of antimicrobial medicines that kill susceptible organisms and keep them from growing. Infections with antimicrobial resistance pathogens makes infection harder to treat and increases the risk of disease spread, severe illness, and death. In the AWARE classification, there are three categories of antibiotics. Access antibiotics that have narrow spectrum activity and a good safety profile in terms of side effects. Secondly, watch antibiotics. Watch antibiotics that are broader spectrum antibiotics and are recommended as first choice treatment for patients with more severe clinical presentations or with infection that the causative pathogens are more likely to resist the access antibiotics. The last one is reserve antibiotics. These are the last choice antibiotics used to treat multi-drug resistant infections. About 90% of antibiotics are taken by patients in primary healthcare settings. It's estimated that half of antibiotics that are being used are inappropriate in some way, such as the use of antibiotics when none is indicated, the choice of antibiotic with unnecessarily broad spectrum, and wrong dose, duration of treatment, and delivery or formulation of the antibiotic. Most otherwise, healthy patients with mild common infections can be treated without antibiotic, as these infections are frequently self-limiting, and the potential medicine-related adverse events outweigh the clinical benefits. The risks of taking antibiotics when they are not needed should always be considered. The aim of AWARE book is to provide short, clinical guidelines of managing of common infections, including recommendations for empiric antimicrobial treatments at the first clinical presentation, and when a no antibiotic approach is appropriate. Guidance is given on the choice of antibiotic that should be used to treat the most likely bacterial pathogens causing each infections in adults and children, the dosage and the treatment duration. The AWARE book is intended for all healthcare practitioners and healthcare workers who prescribe and dispense antibiotics in both the primary healthcare and the facility hospital settings.